This podcast is sponsored by Novo Nordisk. Today, we're diving deep into a topic that affects millions: how our weight impacts our hearts. Joining me, Professor Hussein Heshmat, a leading cardiologist and interventional cardiologist practicing in Tadawi Healthcare in Dubai. He's also a professor in Qasr Al Aini Faculty of Medicine at Cairo University in Egypt and an associate editor in Egyptian Heart Journal. He's also known as @CardioBuzz on YouTube, a champion for heart health who cuts through the noise with clear, engaging content. Welcome, Professor Hussein, to the podcast.
Thank you so much for having me.
So, Dr. Hussein, we hear a lot of different information about heart health, especially nowadays. Give us the top 3 myths about obesity and how it relates to cardiovascular health that you can bust for us today.
Yeah, most people think that obesity is just a cosmetic issue. I need to look good. Yeah. Whereas obesity is a disease, in fact. Yeah. It's been diagnosed, it's been labeled as a disease by the World Health Organization, by the American Medical Association, and by other health organizations. So it's not just a cosmetic issue.
Definitely not.
The second myth is that obesity doesn't affect the heart. It could be heavy on my knees, it's bad for my spine, bad for my liver, but it probably wouldn't affect my heart. That's the second myth. The third myth is that I just need some willpower. If I just eat less, then I don't need anyone. I can treat this obesity that you're calling a disease. I just need some willpower.
Very interesting. So people who convince themselves that they need to go on a diet, it's a myth, is it? Is it not?
Actually, eating seems like a very simple behavior, whereas it's really a complex behavior because it entails emotions, mindset, environment, hormones. So just relying on willpower is a very simplified, is oversimplification.
Right. Okay, so tell us some cardiovascular diseases that are connected to obesity.
Obesity is one of the most prominent risk factors for high blood pressure, hypertension, for high blood sugar, diabetes, for high blood lipids, triglycerides, and abnormal cholesterol. Obesity is also a risk factor for heart failure. It's a risk factor for abnormal heart rhythm that we call atrial fibrillation and other diseases, not only the heart. There's also a link between obesity and some cancers, between obesity and Alzheimer's disease.
Wow.
Lots of things.
That's very interesting. I mean, that data is really concerning. Tell us a little bit more about the recent statistics and the trends that are specific to cardiovascular diseases, and some information that can really be a wake-up call for the viewers that are watching today.
It stems from the way we live. We all live in modern cities. We drive cars. We barely have time to exercise. We barely have time to enjoy with our families. We're under a lot of stress from dusk to dawn, from dawn to dusk, and you name it.
Yeah, everybody's stressed out here.
And that reflects on cardiovascular diseases. So the number one killer worldwide is cardiovascular diseases. People at our age and in our times, people would mostly die of heart diseases. And as we said, obesity is a major contributor to heart disease. And 1 out of every 8 humans is obese or overweight. So if you consider the world population, we're speaking roughly about 900 million individuals being either obese or overweight.
So that's a global statistic, is it?
Yeah, and in the region, it's even more...
it's even more prevalent.
It's more prevalent and more scary, if I say. I wouldn't say more scary, but it needs more attention.
So we've established that weight plays a role in heart health. What are some recent statistics and trends specific to cardiovascular health that may be a wake-up call to viewers?
Yeah, according to the World Health Organization statistics of 2019, 523 million individuals have cardiovascular disease worldwide. And of people who die, 1 out of every 3 would die out of a cardiovascular disease.
Wow.
And if you look at obesity, the data from the World Health Organization, they tell us that 2.5 billion adults are overweight and 890 million are obese. These are the data of 2022.
Great. Well, thank you so much, doctor. What happens to our hearts and our bodies when we start managing our weight and, preventing that obesity?
Yeah, one of the common stories and one of the common scenarios when a patient comes with a heart attack, and then I tell him, take care of your weight, and then I see him in a month. Then he tells me, doctor, I'm so frustrated. I only lost 2 kilograms.
Right.
Well, on the other side, I'm very happy.
Yeah.
I tell him this is an achievement. 2 kilograms in 1 month is a major thing. And people think that they need to achieve their dream weight. So if I'm 160 centimeters tall, then I need to be 60 kilograms.
Right.
Whereas the benefits that we see from weight loss, we start to see them even from 1% of weight loss. So if someone loses 2 to 3% of his body weight, this would reflect positively on the blood pressure and on the blood sugar, just 2 to 3% of the body weight. If people could lose 10 to 15% of their body weight, then their diabetes can go into a remission. Their heart failure can improve dramatically, and they can reverse their metabolic issues. And we know that losing weight, if people lose enough of weight, they can add extra years to their life. So if they are diabetic, it means that statistically they will gain 9 years of living. If they are not diabetic, they would gain like 6 years of life. And that's something to look for.
Just one last thing. How can people become more proactive in approaching their cardiovascular physician when it comes to their weight management?
We were speaking about the small steps that we need to take in our life. So one of these small steps is go and visit a doctor. We said that obesity is a disease. It's not a cosmetic issue. So if it's a disease, then it's better you go and see a doctor. And if obesity is strongly related to heart diseases through blood pressure, diabetes, and lipids, and cholesterol, etc., then you would better visit a cardiologist once in a while if you are obese to make sure that your heart is in good shape.
Great. Thank you so much. Now, a lot of people might say that that's easier to implement in theory rather than in practice. What would you say to people who are really looking to manage their weight? Are there any kind of encouraging words that you can really direct to those viewers who are struggling with weight that might affect their cardiovascular health?
The more you lose, the more you gain.
Okay.
When you shed extra kilos, you will gain a lot. And the same mistake that people fall in, they focus on the outcome. They focus on a target. We live in target-oriented environments. So people think, yeah, I need to lose 10 kilograms so that I look gorgeous in the party.
Right.
Don't focus on the outcome. Focus on the system. What does that mean? Add small changes in your daily practice. You know, there's a famous book, it's called Atomic Habits. So I tell them, focus on the small changes. Don't focus on a final outcome, because if you reach that final outcome, you will stop and you will bounce back.
Yeah.
So focus on modifying your system, your mentality, doing small changes every day.
Thank you so much, Doctor. Thank you very much.
It's my pleasure. Thank you.
This podcast is sponsored by Novo Nordisk. Since we are approaching the end of this episode, Novo Nordisk has created an online HCP locator website to support patients living with obesity to locate the nearest physician according to specialty. And I encourage all healthcare professionals to have open conversations with adolescents living with obesity